Welcome back to another episode of the Fireside with Jade. I'm your host, Jade Natasha Iriza, and I'm thrilled to have you join us once again. Before I welcome our guest, I would like to take a look at what the Rwandan law relating to human reproductive health provides for. The law that was established in 2016 defines family planning as a way for people to attain their desired number of children and to avoid unwanted pregnancies, taking into account the welfare of the child, the mother, and the family. According to the official gazette, the key components of human reproductive health are self-delivery for the mother and the newborn, care for the newborn, family planning, prevention and treatment of sexually transmitted infections, including HIV/AIDS, prevention and treatment of other infections that are harmful to human reproductive health, prevention and treatment of infertility, prevention of gender-based violence, and care for victims, and raising awareness with the aim of change. Among other articles, Article 7 is about the right to decide. Subject to provisions of the other laws, every person having attained the majority of age has the right to decide for oneself in relation to human reproductive health issues. And then, Article 8 is about the right of access to education and medical services, meaning that every person has the right to access education and medical services related to human reproductive health. Also, an HIV/AIDS infected person has the right to services and necessary medical care consonant with his or her disease conditions, taking into account the national financial capability. Therefore, the government, public institutions, and other institutions in charge of human reproductive health have the obligation to provide necessary medicines and health services close to any person in need thereof for him or her to have good reproductive health. Now, this sounds very good, and we're so glad that it exists. And while it covers pretty much the overall basics, there is of course room for improvement. On this note, I'll go ahead and welcome Juliette, our guest for today. Juliette, thank you for being here today, and I'll let you introduce yourself better to our audience and say why you're passionate about this particular topic.
Thank you so much, Jade, for having me today. And this is a very important conversation to have. So my name is Juliette Karitanyi. I'm a feminist and activist, and I've been worked in the health or reproductive health sector for more than 3 years, and also been part of feminist group that have been advocating for rights of women, especially for young people and adolescents. So basically, that's about me.
Let's start by discussing the term family planning. You see, many people associate this term with married couples or those that are in committed relationships, and hence are thinking of actually making a family together. So do you think the naming of contraceptives as family planning contributes to the stereotype and the stigma around the topic? Or, if I can say that, do you think there is even a stereotype and stigma around the topic in the first place, or am I just making this up?
No, there is definitely. So family planning definitely contributes to the stigma around contraception, especially in Rwanda, where it is called kuboneza urubyaro. So most of the time when young women or young girls try to access the contraception, they always ask them, uraboneza urubyaro utaragira, or like, why would you plan for children that you haven't had yet? So that's why we encourage people, especially people who give services or even journalists, to keep using the word contraception, which is kwirinda gusama, or contraception. So most of the time now when they use the family planning, this can marginalize unmarried individuals, definitely, and young people who might require contraceptives, and they feel like they're excluded. So using more language that are inclusive, that will help young people to feel, to have agency, and also feel like it's important for them to also have access to these contraception methods. So yes, definitely there is a stigma around it.
And I agree with you. The term implies that contraceptives are solely for those who are married and want to plan for their families. And this narrows the focus, which excludes single individuals who are sexually active and in need of the contraceptives. So, yeah, intentionally perpetuates the stigma and creates barriers for those outside the traditional family structures. Because, research shows that many young and single women do not go consult their gynecologist or any other medical because they do not want to go through the process of being asked many questions of why are you here, where is your husband. Even those who go to take some pregnancy test are asked such questions like where is your husband, and they just assume that you're married, which is not correct, and so it's wrong. Tell me, how do you think we can redefine the naming and the messaging surrounding contraceptives to be more inclusive and remove the associated stigma?
So definitely we need to start calling it contraception, or even the adverts. Most of the adverts, I don't know if you realize, it's more about couples. It's more about married couples. Even at the health facilities, you will never find adverts that shows a young woman who's coming for test, or she's coming to get a contraception by herself. So we need to have those awareness campaign that are not centering on couples only, but also are centering on individuals who go there, and also making it more accessible. They are accessible, but having more stigma free. As you said, people always ask you about your husband and all these uncomfortable questions. So we need to have healthcare providers who are aware that when they ask this kind of question, they make young people very uncomfortable. So keep also like that the terms of contraception or kwirinda gusama than using the whole family planning word. They can use that for couples, but also we need to bring that kwirinda gusama more frequent in our in the Ministry of Health, or even at the health facilities, in the adverts. Especially so now in September, we are going to celebrate World Contraception Day. And most of the time, that's the only time you hear saying contraception or period of summer. So we need to hear that throughout the year. So,
Okay. So speaking of stigma and stereotypes, do you ever wonder why there is plenty of contraceptives meant for women's body, but way less for the male? And why do you think it is regarded as a woman's responsibility to think of this particular issue? And then you will find that women not only bear most of the health-related burdens of contraceptives, but also the financial part of it. Why do you think it is that way?
Definitely the whole, I would say the whole world, or people who have power will have structured the contraception narrative and around women. So they have put that burden on women. And yet we always talk about it, that a woman can only get pregnant once in a year, but a man can impregnate so many women throughout the year, right? But we need men and women to restructure the whole health system, not only in Rwanda, but from the research point of view globally, where we need to see contraception products that are for men as well, even those that are currently available, such as condom and vasectomy. They are not as popular as they should be. Yeah, I remember when I was starting to work with an organization that I was working with a few a month ago, HDI. So we did a campaign on vasectomy. So it was during, it was September. So we did an online campaign around vasectomy. But the backlash and so many myths around vasectomy was shocking. You know, they think that we want to make men infertile, and that and it's not a very good contraception. Until like the following year, I had to go and find data, and I realized that in Rusizi we had a lot of men who actually are using vasectomy. So we need to hear more of those stories. So definitely, the disparity in contraception option for men and women comes from a historical and cultural norms that have placed the responsibility of contraception on women. So this definitely perpetuates gender inequalities and can lead to unequal burdens in terms of health and definitely, as you said, financial aspect. And here I would say that Rwanda has done a very good job with the Mutuelle de Santé that we have. This has actually helped women not to go to ask financial support to their partners. So they would go directly to the health centers. And this has also actually helped in increasing the uptake of contraception in the country. So this is a good thing, but we need more contraception, at least those that we have currently, you know, the vasectomy and condoms to be more popular. But also, there is also an issue of men being partners, men being supporters. But we need to make reproductive health very inclusive, showing that men also need these reproductive health services. So most of the time you hear that it's as if you have to support your wife, you know, but these are yours as well. We need to teach men that they have to have access to reproductive health services, such as going for prostate cancer tests, you know. And most of the time, when we are talking about reproductive health, we tend to only talk about contraception, but it's very broad. So we need to make them also beneficiaries of reproductive health services as well.
This one is very interesting. I would actually want to know and hear from people themselves why they think that even the few available options for male contraceptives are not very much explored. Are they that they are more harsh, or are they that there is more cultural stigma existing around it? So it's worth exploring. So now let's go back to the landscape in Rwanda. The law, it states that individuals under 18 years old cannot make decisions regarding reproductive health. Do you see this restriction impacting access to contraceptives for young adolescents who may already be sexually active?
Yeah, definitely. We by what we are seeing, you know, numbers don't lie. We can say the culture, religion, we can always make excuses and all these things, but we see always every year teenage pregnancies are very high. More than 20,000 of teenagers get pregnant in Rwanda. We also see something that is not being people are not talking about it, is that new infection of HIV are between people who are between the age of 17 and 24. So there is also a very big component of malnutrition among children of teenagers, of teen mothers. So most what I read is that 60% of children born from teenagers die before the age of 5. So this whole law affects definitely the most vulnerable, who are young people below the age of 18. Now, I always joke about telling people, even at my age, I can't tell my mom to go with me at the hospital. How do you think a young person who's not even allowed to be sexually active, to go and tell their parents to go with them at the hospital. It's impossible. And they know, and they know it. Yeah. So definitely this affects the way they access contraception. It restricts them, and this limitation can definitely affect them for the rest of their lives. And also the fact that we have more women or young girls who are getting pregnant, that also affects our advancement of gender equality, because we want girls to be in schools, we want them to excel, we want them to get to have jobs. And now we have a lot of young girls getting pregnant. They're going to raise, like, it's babies raising the other babies. I would say there is also the part of an unsafe abortion. Some others even die, doing unsafe abortion, even if today, which is very good, we have the ministerial order, and I know so many organizations are doing an awareness around the ministerial order. And definitely, from what I've seen, is that women are actually going to health facilities to have a safe abortion. But definitely, this law affect many young people. Yeah.
I think it's up to our society to accept the reality that young people are involved sexually, and that they are actually should be in position to have access to comprehensive sexual education and reproductive health services, which are tailored to their age group if need. For example, if they need to establish some control, then clear the guidelines and support the systems can still be made clear to ensure that their well-being and protection is prioritized, but we need to give them access, right?
Yeah, definitely.
Juliette, still on this, it brings to mind the recent rejection of the bill of contraceptives from 15 years old by the parliament. Do you have any thoughts on this decision and how it impacts the reproductive health rights of adolescents in Rwanda?
So the rejection of the bill definitely wasn't, it was very bad to hear that the parliament rejected it. And this decision might lead actually to more, like, to high rates of unintended pregnancies and the spread of STIs. But we also need to see this as that when we are restricting, or when the bill is not passed, most of the time this is going to affect more women. It's going to affect young girls. And also that they only looked at that article to allow 15 the young girls who are the age of 15 to access contraception. But the bill is big. The bill is broad. It has we need to look at reproductive health system in a broad way. Like, we have to look at it as a reproductive health system that includes also diseases, cancer, assisted reproductive methods such as IVF and surrogacy. So it wasn't a bill for only allowing 15 years old to have access to contraception. It's a very broad bill. So I would recommend, because it was shocking to hear some of the MPs' interventions. Most of them were more of assumptions than data. It was more of religious and cultural interventions. So it's as a country that is not a religious country, so we base most of our decision from data or science. And I know the Ministry of Health has engaged the parliament to talk to them and show them that even WHO also shows that a woman can start using contraception from the age of 15 and above. So definitely science is telling us that it's fine, and we need the MPs to do more work and exercise and read to actually understand that this bill is actually going to help women to have more agency, more access and also to reduce teenage pregnancy, because and also even the whole the people who give the services. I heard from so many healthcare providers who work at the youth corners. They say that they receive teenagers from like they receive young people from all ages, from the age of 13, 17, and they give them sometimes these contraception methods. But because the law is there, sometimes they fear, So it's very important for us as a country to revise it. We have numbers of teenage pregnancies everywhere. We can see that it keep rising. So we need actually to go back and look at the law. So we need more advocacy efforts from the civil society, and then also engaging the public as well, engaging the community to just show them and make them understand that this is an issue that needs to be tackled, but not only to look at only that article where they're saying access for contraception for young people below the age of 15, but to look at the whole reproductive health bill.
And what you just said may want us to tread a bit carefully on this, because you've said it. Many Rwandans base their sentiments mostly on culture, religion. But then, how do we ensure that this does not conflict with them? I mean, how do we ensure harmony? Or is it a lost battle? One has to go and the other has to remain.
I would say that advocacy takes time. When I was talking to people who did the advocacy about access to safe abortion, they will tell you that this took 10 years or 12, and it's very important that we don't also take that much time. Yeah, we would wish for it to be revised very soon, and also so that they can take a very positive stand about it. So definitely we need to talk to a lot of people, especially journalists who also make this kind of topic more aware to the public, and also get them to talk about it and encourage people not to talk about it from the angle of religion or culture. That is, I'm sorry, but that is not science. We need to go to science. And if you want to teach people about abstinence, that's okay. You can. I think it's important as well. But at least let's help those women or young girls to make their decision freely, and also build that agency,
I agree.
in them.
So this the fact that we are still having this conversation shows that there are still a lot of challenges to tackle. And when you look at this, Juliette, what do you think are some strategies that could be implemented to overcome such barriers and ensure that all individuals, including adolescents, have access to necessary reproductive health services? Do you have any recommendations in mind?
Yes, I have a few. One is that we need comprehensive sexual education to be taught in schools. We have a curriculum, so we need teachers who are not shy, teachers who don't come to teach about CSE with a cultural or religious mindset. So we need it as a standalone course that is taught throughout, in the whole, in school, yeah? And we need also teachers who are able, I don't know, we can also, there is a way they can see how to even include nurses to go and at schools and teach, this kind of, the CSE. But also we also need youth-friendly youth corners. By this, I know we have youth corners, but we need nurses who give stigma-free, judgment-free services, who are also young, who when young people go there, they don't feel like they're talking to their grandmothers. So They're
Yeah.
talking to their mothers or their uncles or their. So we need that as well. So we need also community engagement, engaging leaders and parents and guardians in this kind of conversation that are very important. They need to understand that when we have teenage pregnancies, it doesn't only affect their health and economy and education and gender. They need to know that it's a whole threat to the development of our country. So we are actually letting down these young girls. We shouldn't be. We should be ashamed, and we should really look for more solutions. To reduce teenage pregnancies. We need also more campaign. I remember growing up, we had a Sinigurisha campaign. And at the time, I never felt so proud to be a young person who would say no when I, wearing that orange wristband was such a pride. And I no longer see those kind of campaigns. We don't see campaigns around awareness of contraception, gender, so we need more campaigns to actually reduce stigma and also promote positive attitude toward contraception for both boys and also girls. Yeah. So yeah, I would say those would be, but also teaching girls about agency. We rarely teach young women that they should have a negotiation about relationship, about sex, about what they truly want. When they want something, it's okay for them to say yes, but also know how to actually prevent diseases, pregnancies, but also to say yes when they want, and also to say no when they don't want to do anything, because most of the time, because when you grow up as a young woman and the decision around your health is being taken, or reproductive health is comes from your parents. So when you grow up, that's when you find out that most of Rwandan women, when they want to make a decision about contraception, they will always consult their husbands, So you realize that women tend to feel like their body is not theirs. So we need to actually bring that to them and tell them that this is your body, you can make a decision, and teaching that from a very early age. You're not going to teach someone about reproductive health when they are older, So yes, it's possible, but it's really better to teach them when they are still young. Yeah.
Well, one thing I'm taking out of everything you said, Juliette, is that this is not a one man's business. It concerns the government, concerns the young women, concerns the institutions, educationists, medical health staff, like literally everybody. And hence, we should make it, a point to and educate ourselves about the subject. Well, I think go on and on, but we cannot exhaust all of it in one episode, and hence let our audience decide if they would want us to look at more details on this specific topic in the upcoming episodes as well. And the truth is, this conversation around access to contraceptives and reproductive health in Rwanda is crucial to building a more inclusive society. And it needs to be discussed openly and continuously until we reach the level we want. As you said, advocacy takes time. So I think we are going to conclude this episode from here, but feel free to share any of your parting thoughts.
Thank you. So definitely, my last message would be to make people understand that this needs a multifaceted approach. As we said, we need advocacy, we need education, policy change, definitely. We need community engagement so that we can keep talking about, we have all this open conversation about it, but also remembering that we are not doing this for ourselves. We are doing it for young people. We always say that we need Rwanda needs to have a good future. So we can never have a good future if young people do not have the power to make informed decision about their reproductive health. So let's do it for them. And definitely when they look back, they will say that some people did something great for us, and they will carry on with other issues that will be in their time. So yeah.
I agree. And thank you, Juliette, for voicing all the points that I really was looking forward to have someone bring up. So thank you for not shying
Oh, thank you.
from advocacy. You are a hero.
Ah, thank you so much, Jade. Thank you.
So, we've arrived to the end of this episode. I urge all our listeners to actively engage with us by sharing their thoughts, questions, and suggestions. Together, I believe that we can be a catalyst for positive change and push for an inclusive approach for reproductive health. I want to express my gratitude once again to our listeners, supporters, and our incredible guests, Juliette. Without your participation, this platform would not be possible. Stay tuned for our next episode, where we will continue our exploration on public policies and how they relate to gender equality. Until then, take care. Thank you for tuning in to the Fireside with Jade. Remember, you belong here if you look forward to igniting change and creating a more inclusive world. Don't forget to subscribe to our podcast and follow us on all our social media platforms to stay updated. Until next time, take care and keep the conversation going.